The whole fertility world is absolutely wild, and the costs are outrageous. We spent well over $250,000.
Welcome to FemMD, real talk for women who are balancing careers, ambition, and the chaos that comes with it all. Today, I'm excited to chat with Dr. Melyssa Hancock. She's in Boca Raton. She's a double board certified facial plastic surgeon, someone that I have met in a previous life. And today we are going to take a deep dive into her IVF journey and becoming ultimately a mother. So Melyssa, thank you so much for being here today.
Sure.
Distinctly remember the first time I met you. It was on the interview trail. I don't know if you remember this, when you were a fellow and I was an applicant, and you were like the most real person I met on the interview trail.
Gosh.
You were like, this is how it goes.
The things I probably said.
But I feel like so many people are like, la-di-da, we should mind our P's and Q's. And you were like, no, this is what happened to me. And I'm here today to tell my tale.
I mean, that's the reality of it, is that you're in it, and sometimes you just got to go with the flow and do the best you can with what you got.
And you saved my ass one time at a meeting because my presentation wouldn't load, and I was like panicking in the back. Do you remember that? You lent me your laptop.
I mean, I don't remember you panicking, but so you were very cool under pressure. But yeah.
So I want to dive straight into your whole IVF journey and talk a lot about it, because I think it's something that is so common. Like every one of us has either had fertility issues or have like a very good friend who's been through it. You went through 12 rounds of IVF over a 3-year period. Walk us through some of those like initial stages of the process.
Sure. So initially, when I had started this whole fertility journey, it was really just about fertility preservation. You know, I had said, you go through training and you're moving every few years, and you have in your mind like, oh my gosh, when is my personal life going to catch up to my professional life? So I always said if I was in a position to do it, that I would freeze my eggs, just so that it took some of that pressure off. I knew I wanted a family. I just didn't know when it would happen. So that's really what started this. And I ended up going and getting a fertility evaluation with one of the local IVF doctors, and everything was fine. He said, "You're great. Everything looks good. You've got the eggs of a 30-year-old, and I was 34 at the time. I said, "That's awesome." So at the time, I was dating this guy who's now my husband, and we'd been dating for like a year and a half, a year maybe. And I had done my research, and I knew that embryos actually generally did better than eggs when it came to freezing. So being more realistic about the situation, I said to him, I see where this is going. Would you want to be a part of this with me? No pressure. Do you want to donate your sperm, basically? And he said yes. So my first actual round of IVF was to freeze embryos. And at that time, I only had done one egg retrieval. That's really the first process, is to get your eggs, and then you either freeze your eggs, or if you have sperm, then you try to freeze embryos. So that's what we did. And then fast forward, we ended up getting engaged, and then we put things on hold because we got married. And so over the time, like a little bit before I got married, and for about 4 months afterward, we had tried to, get pregnant, and it had been about 6 months. So that's when I went back to our fertility doctor. And did another 4 rounds of IVF. So we did 2 IUIs, which are where it's basically a turkey baster of sperm up your lady parts. And then 2 transfers that didn't work. So at that point, and the transfers are where they take a frozen embryo and they implant it. And at that point, we didn't actually test our embryos because I was under 35. So the recommendation was not to test your embryos to know if they were normal in terms of chromosomes or other kinds of genetic abnormalities. So after the second failed transfer, that's when I had a conversation with the doctor, and it just didn't go very well. So I decided to go elsewhere.
Tell us more about why was your spidey sense off about that doctor, that clinic, the care you were getting?
So, it's hard sometimes not to feel like just a number, because at the end of the day, this is a business, and fertility infertility is a very lucrative business. My insurance didn't cover anything. So when you start to go through this process, you learn so much, and there's so much information out there, but you just don't know sometimes what to do with all of it. And so I think, I always thought to myself, how do people without a medical background understand any of this? Because there's just words and all these procedures and tests and labs, and you don't really know what to make sense of it all. There's all these meds, and suddenly you're injecting yourself with all this stuff that the doctor just tells you to do. And you're like, okay, I guess this is what I'm supposed to do. So when things don't work, you really start to question things. And so I'd question the doctor, like, what's going on?
Why have we had 2 failed transfers?
Right. And, his response was, well, it takes up to 3 to have success. I said, okay. I said, is there anything else we can do? And he basically had said to me something along the lines of, well, you're the doctor. Why don't you tell me? And he was basically annoyed that I was sort of questioning what was happening, or why, bringing up questions that maybe were, more technical or something. But I also had seen in my chart that I'd asked for my records just to review them, again, being sort of like just kind of
an informed consumer of your health care.
Exactly. Yeah. It kept saying male factor infertility on my chart. And my husband had no problems with his sperm, which, sperm were perfect. So
I chose a good mate.
Yeah, that initial, sperm donation ended up being a good one. But I said, why is there male factor infertility in my chart? And he said, well, it was done on the workup. I said, and I questioned, I said, no, he's had 2 sperm workups with you guys. No, nothing was told to me. And so it was really that I think kind of annoyed him, that, and maybe he was taken off guard or something, but the conversation just kind of went south. It ended up being a little bit, uncomfortable. And, when you're literally putting your, most sensitive and most fragile sort of, I guess, hopes, with a doctor, you really need to trust them and feel comfortable. So that was where I was at that point.
I would also say, like, it's such a charged situation just at baseline, because it's like your emotional milieu of like all these crazy feelings that go on. Plus you're adding these hormones.
Yep.
And it like involves your marriage, and you're paying these insane amounts of money out of pocket.
Yep.
Like, I cannot imagine a more charged environment for like when you have questions for your doctors, or if things start to kind of go south, so to speak.
Yeah. And there's just, this process is a live and learn, and you don't really know who to talk to sometimes, it's very much like, oh, just do this and it'll work. Oh, I took Mucinex and that solved my problem. Or, there's all this stuff out there. So when you're just trying to get information, you have to feel comfortable, and you need to have a doctor that can handle those charged situations, or can be able to explain why they're doing what they're doing. And so at that point, I said to my husband, I just looked at him, because it was actually on a Zoom call, and he looked at me, and just with his face, I knew he was done with that doctor. And so was I. And so coincidentally, we had a consultation scheduled with a doctor. His name is Dr. Suri at CCRM, out in Colorado, actually. So we live in Florida. And so we did a Zoom consult out there, and I had done a lot of research, and CCRM Lone Tree was the original location of that CCRM, company. And they just their lab had this like stellar reputation. So I figured, if nothing else, maybe I'll get some information from him, because that's the beauty of a consultation. So that's what I did. And we just felt comfortable. So at that point, that's when we decided to move forward, out in Colorado. So he basically suggested that at this point, we need to test the embryos that I had already made. So I had 3 remaining.
So you can you can transfer those embryos from one clinic to another.
Yeah. So you basically pay, and you fill out ridiculous paperwork. Like, do you want them packaged separately on separate trucks? Like,
insurance policy wise, if this truck gets hit by a bus or something.
Yep.
Yeah.
Oh yeah. So those
okay.
precious little jewels were placed on separate trucks and separate packaging. And it's just, the things you never really think of. So we transferred the embryos out there, and the plan was to do another egg retrieval because they basically say you need 2 to 3 normal embryos per wanted child.
Okay.
So
that's the ratio.
Mm-hmm. So in our mind, we needed 6 embryos. So at this point we had 3, and we didn't know, for sure that they would be normal. So we transferred the embryos, and we were going to do another egg retrieval. And that egg retrieval, I actually got nothing. I didn't have any eggs, or they fertilized, but none of them actually made it to what's called the blast stage, which is where they can test it and freeze it.
And before the egg retrievals, just for anyone who's unfamiliar, they give you extra hormone shots to basically like ramp up the egg production facility.
Yeah, the egg retrievals are really the most intense in terms of monitoring in labs, because basically every other day to every day for 2 weeks, you have to get an ultrasound to assess how many eggs you are, or how many follicles you have and what size they are. And then depending on the number of follicles and what size they are, that's when they give you what's called a trigger shot, where the follicles release the eggs, and that's where they capture them in their, little test tubes.
So let's pause for a minute. You're also like a great surgeon with this like booming career. I'm trying to figure out how logistically this is working with all these appointments. Also, like, you practice in Florida, your clinic's in Colorado. Like, walk us through how chaotic that part was kind of when you were in the middle of all this.
So it actually, the first round of IVF that I went through, I'd gotten pretty busy pretty fast. I had joined a doctor in practice who had been in the area for like 35 years, and he was fantastic in that way. I got really busy, which was great. And I had been offered a partnership early. So right before that was happening, I was like, okay, I'm going to do this, egg freezing embryo thing before that happens. And it was the first time I did. I mean, I hadn't taken vacations for almost a year and a half. So like I had PTO time, whatever. At that point, I was still technically an associate. So you had rules and stuff. But anyways, actually my partnership had gotten pushed back by a month because I had missed too much work for my embryo egg freezing process.
Okay.
So I learned a lot from that situation. And I also decided at that time that I needed to prioritize me and my family, because at the end of the day, nobody is going to help advocate for building your family. It's still, medicine is still a business. And when you're in private practice, time is money. And I get it. I understand from his perspective. Like, I brought on this associate, she was doing so great. And then all of a sudden there were like, and at the time I wasn't open about what I was doing. I wasn't,
okay.
I wasn't, I was embarrassed, I didn't know, fertility was still like something that wasn't, it was too early on to really feel like I had any kind of community or I knew people, because I just wasn't talking about it. So at that point, I ended up becoming partner. And at that point, there's not time off and stuff. And I just had to rearrange my schedule so that I did most of the monitoring here in Florida with a local clinic. And then I would really only need about a week off in order to
fly
go
to Colorado.
Mm-hmm. Yeah.
Okay.
It was, scheduling was definitely tough. I had to, thank God, I have really an amazing staff, especially my office manager, who just was like, let's make this happen. Let's get you a baby, like whatever you need. So it definitely helped to be able to have control over my schedule and have someone in the office to support me and kind of help me through that.
So then you established care with your clinic in Colorado. Also, I want to ask, like, red, blue, purple, politically, the states have been through this like big upheaval with like women's rights. And did you think about that at all? Like, being in Florida, is like, did that alter your decision? And like, well, Colorado seems potentially safer to have stored embryos. Like, did that enter the discussion
not at the
all?
time, but
okay.
In hindsight, it couldn't have been a better decision. But yeah, I at the time, I wasn't even thinking about that. But as luck would have it, I did do everything in Colorado, and they are currently stored there. So, and even in terms of, if for any kind of termination stuff, like at least I had care established elsewhere. if
Mm-hmm.
that were to ever be the case for me. But yeah, at the time, no, didn't even cross my mind.
And then how is your marriage at this point in time? Like, are you guys sensing, because I have some good friends that have gone through
Mm-hmm.
IVF, and like it's
Mm-hmm.
a real struggle. And you're going through the same thing together, but it's just all these emotions of like,
Mm-hmm.
one of my best friends used the term like I feel inadequate, like I feel
Mm-hmm.
like, talk us through like your emotional state in your marriage at this point.
I think at this point is when it really started to get tough. We were very hopeful. Again, we'd been told there were no problems. We had no idea the timeline that was ahead of us. And that's one of the things that I do tell people who are new to this process is do not put a timeline on things. Don't expect to be pregnant in 3 months. Don't say to yourself, this is my last birthday or my last Christmas as just the two of us or without a baby, because there may be 2, 3, 4 birthdays or Christmases or family holidays or whatever it is that go by and you're still not pregnant. So at this point now, we had been doing this for over a year, almost a year and a half or 2 years at this point. No, yeah, about 2 years at this point. So it was a struggle and the hormones didn't help. I mean, I felt sometimes like I was looking at myself from like outside of myself and trying to tell myself to be like, calm down, be rational. Like, this is just the hormones, but you just don't feel like yourself ever. And that's really hard.
In what way? Like, how do you not feel like yourself?
There's just this, you feel like an emotional mess. Like every day you wake up and you just don't know how you're going to feel. Meanwhile, you are sitting here injecting yourself with, I mean, every round costs us at least $10,000 to $15,000 worth of drugs. And you start to feel very isolated because it really begins to hurt that everybody else seems to be having babies and you're not. It feels, you start to just, I mean, you can't go anywhere without thinking like, I wish I had my baby. Why don't I have my baby? Like, when is this going to happen for me? And it's hard. And my husband, who's very social and, he's much more chill than I am. So we balance each other out, but he was really helpless. So a lot of his frustration with the process was that he couldn't do anything to help. And we had this funny, well, now it's funny, but this argument where he had said to me, if you start to feel like you're overwhelmed or I start to feel like you're being irrational, we should have a safe word. And I just looked at him and I said, if you value your life, you need to take that back right now. No woman in the history of womanhood has ever calmed down because you said calm down or said a safe word. I said, what do you want to scream gummy bears? And like, I'm supposed to magically snap out of like whatever, moment I'm having. But it was hard. I mean, we were newlyweds basically, we were supposed to be having fun and enjoying making our family. And here we were just struggling and we didn't know why. And that was the worst part.
It takes the fun out of having sex. Like,
it's completely.
Yeah.
I mean, by this point, it became like not an act of intimacy, but a chore, and that was hard. And to kind of be in that stage so early in your marriage, I wasn't expecting that. I thought that was like the 7-year itch or something like that. Like I wasn't expecting that so soon.
You're like, I need the rainbows and butterflies of newlywed.
Yeah.
I didn't sign up for this.
Yeah, this is not, and neither did he. And that was the hard part too. It hurt me because he didn't sign up for this, and there were doubts in my mind. Like if he knew it was going to be this hard, would he still have married me? And that was something that I really struggled with. And of course he reassured me that wouldn't be the case. But in my mind, I was like, if he knew that starting a family was going to be this difficult, would he have loved me? Would he have married me? Would he have wanted to be with me?
So for thoughts like that, did you have some external like sources that you could lean on? Like, were you going to a therapist? Did you have good friends who you could talk to? Who was like your outside support system?
Yeah, it really was. I had a friend of a friend actually became like my point person for asking so many questions because she had been through the absolute ringer. And she was probably one of the best resources for me because she had been through it and she understood, and she had guidance and suggestions, but also understood the emotional roller coaster of it.
Mm-hmm.
My mom was amazing. I had friends that didn't really understand it. And, when in our busy lives, sometimes it's hard to keep up with each other as it is. And I really had isolated myself. So I had certainly lost some friends over this who kind of took it as I didn't care about them or my struggles were more difficult than theirs. And I did. I actually started seeing a therapist because I just needed to have somebody to talk to. And eventually, my husband and I ended up seeing this marriage counselors. They were a male and a female who were absolutely wonderful. Just so that we could sort of sort out how to communicate better in the midst of all of this.
Gummy bears.
Yes, exactly. Right. And
that
they
wasn't
were
one
wonderful.
of the tactics.
No, they did not recommend shouting out a safe word at all. But all of those things were incredibly helpful. And that's another piece of advice I give people is don't lose your marriage or yourself in this process because it's so easy to do. So, at that point, find somebody or someone for both you and your spouse, because it's not just affecting you. It's affecting them too. So those were certainly helpful.
Okay, let's catch back up here. So you did your first egg retrieval in Colorado and they got no eggs.
Correct. And they had moved forward and tested the remaining 3 embryos. One was lost during the thaw. And then one was normal and one was abnormal. So we're now down to 1 embryo at this point. Which totally threw us for a loop because now we were here. We had just changed clinics. We moved our embryos. We thought we were, I didn't test them before. So now I'm thinking, were those other embryos abnormal? Did we waste our money and time? And now I just felt like we were almost starting from the beginning again. Here we were. And it's like, we wanted 2 kids. So now I have to get 5 more. And I've already had 2 rounds egg retrievals and I have 1. At this point, I was just like, the end is, I don't know when this is going to happen. And that was especially when things like ramped up for emotionally and just in our marriage. And so we ended up going right into another egg retrieval. We changed the medications. We only got 1 embryo and it actually was normal. So now we had 2. Again, the sort of the number of follicles I had really changed between like what my baseline was and what I had during these 2 egg retrievals. So I normally had like 18 to 20 follicles, meaning I could potentially have like 18 to 20 eggs at any egg retrieval. But these 2 egg retrievals, for whatever reason, I only had 5 and then like 8 follicles. So at that point, my doctor was like, let's do the kitchen sink. I don't know why you're not responding to the meds, but we're going to throw everything at this. And I said, okay, let's do it.
Okay. So also being like medically trained, evidence-based, you're like, we've done all the right stuff, but to get a little fringy granola for a second, like, do you think that all of this like emotional stress and toll was presenting itself with fewer follicles?
Absolutely. Absolutely. But what was the alternative?
That for sure. But I just like,
yeah.
You read these studies about how like stress really impacts your health. And like, there's a very like solid example of fewer eggs. Okay. So you guys throw the kitchen sink. What does that mean? Like just more drugs?
Like the maximum doses of like every egg retrieval drug that's out there.
Okay.
And so this was, so that was in December. So we ended up getting 8 embryos, 4 of which were normal. And they actually, I think there were 13 eggs that fertilized. I specifically remember this because for anybody that knows me, they know I'm a Swiftie. So the night before the egg retrieval, I'd gone to see the Taylor Swift movie out in Colorado by myself. I just needed to like, I don't know, zone out, do something, be distracted by a bunch of screaming Swifties or something, with my wine and popcorn. which I did. I had wine, which they say is bad, but I didn't care. I had a glass. So anyways, so then I had the egg retrieval, and then I get the call the next day that I had 13 that had fertilized, and I was like, oh my God, it's, 13 is like Taylor Swift's number. Anyway, so that's where the crazy Swiftie in me came out. But we ended up getting 8 embryos. 4 were normal, and 1 was what they call a mosaic. So it could be normal, it could be abnormal. So at this point now we had 5, which just put a whole new, just outlook for us.
Yeah.
I ended up getting something called OHSS, which is ovarian hyperstimulation syndrome, though, because of all the meds. Like this, they're basically like, I had like 10 centimeter cysts in my abdomen, and I ended up getting peritonitis and being out of work for like another week.
Oh my
because
gosh.
it was like, I ended up being in the hospital, and it was like a whole thing, which is a risk. They monitor your estrogen, and my estrogen, I think it was like 12 or 15,000, which I think anything over 6 is a risk for OHSS. But in my mind, it was worth it. But by this point, actually, because of those last 2 egg retrievals before this, my husband and I had actually started talking about donor eggs, which we really didn't want to do, or a surrogate. So we had actually decided that I would keep doing egg retrievals. And even if I only got 1 embryo at a time, we would use a surrogate, so that we could still move forward with the transfers of the embryo. So basically my husband would have, instead of 1, but 2 women in his life that would be going through IVF.
Because you couldn't get the transfer if you're continuing to harvest eggs.
Correct.
Yeah.
Correct. And at this point, I was now 36. And I was like, okay, I mean, I'm not going to stop until, in my mind, I was like, I'm not going to stop, trying to get embryos if there's still options out there. So we had started the surrogacy process and ended up matching with a surrogate here in Florida. So we went as far as, and this is happening at the same time that we had gotten our embryos, and we were going to try to move forward with the transfer with me, but we were still going through the surrogacy process because we didn't know how many transfers it would take to get a baby. And we weren't even sure if we were going to meet other obstacles with the transfers, because we never expected any issues with the egg retrievals.
And then from a surrogate selection process, is your clinic in Colorado guiding you in how to do that, or?
So they do have a surrogacy program, but it takes about 1 to 2 years typically to find a surrogate.
Oh my gosh.
So that's why we had actually started the surrogacy process, was because we knew that it would take a minimum or at least a year. So we ended up using it was actually a very good family friend, who had a relative that is one of the top adoption and surrogacy attorneys in the country, who also is affiliated with a surrogacy agency, and helped us really just navigate the process. And we were fortunate enough that, a lot of it is selection on both ends. And you have to have, most surrogacy agencies will not allow you to be a client, I guess, or a patient and transfer unless you have tested normal embryos. They won't transfer untested embryos.
Yeah. Because it potentially puts that surrogate at a higher medical risk during the pregnancy. Yeah.
Correct. And they get paid, which I learned through all this process, at certain points along the way. So they don't want to enter a journey where there's an abnormal embryo, because that means for them that they won't make it to the big payday. And not that that's what their intention is, but that's the reality of it, is that it's a job. And that's the only way that I could think of it. I really had to think of it as a business transaction to some degree in order to be mentally okay with it. Because that's a really hard decision to make as a very type A, need to have control, sort of, ultimately a perfectionist at the end of the day. So to be able to say, I'm going to give somebody else total control over my child and let them do something that I'm supposed to do, but I can't. Sort of the fighting those feelings of being how as a woman, is this the one thing that I'm supposed to do naturally that I can't? And how as a mom, like, what is that going to mean for me and my child? How is this going to affect my marriage? Is my husband going to think less of me because I didn't carry our child? Like, all of these things are going through my head. So I really had to look at this as a business transaction in order to, get to that point where I could be okay with it and know that the goal was the real, like, I just wanted a baby at this point.
Do you think your background as a surgeon helped you with that, like, compartmentalization tactic?
Yes, definitely, but also counted against me. It's like, as surgeons, we like to be in control. We don't like things that we can't, that are out of our control. And we do so much of our job is trying to control those variables that we have no control over, which is still a struggle in my professional life to, like, let go of those things. Like, I cannot go home with every patient and help them, heal. Like, they have to be adults. They have to be, put on their big girl diapers or big boy diapers, and they have to, but it's just, a surgeon, I think, helped, but it also, again, there's those personality traits that sometimes you really have to work to overcome to be able to be okay with this kind of situation.
Okay, so you guys locate your surrogate. You are getting the legal ball rolling, the transactions set up.
Yep. There's psych evals, there's medical evals, there's a lawyer. It was a 44-page contract that we had. She had a lawyer, we had lawyers that were going back and forth. Everything from, everything from monetary stuff to diet. Do you want her to eat fruits and vegetables only? Do you care if she eats red meat? Do you, is alcohol, in products okay? What sort of, do you want her to be allowed to drive a car? Because what if she gets into a car accident with your baby? What hospitals are you okay with her going to? Do you want to be at all the OB appointments? Who do you want in the room with you when you have the baby? And then there's also the other part of it, which is the part that really hit me, was that her name goes on the birth certificate in the hospital when you use a surrogate. And then you have to go through a legal process afterward to get my name on it. So it would be my husband and our surrogate's name on our baby's birth certificate, even though genetically the baby was mine. Which was like a whole, like, just, I don't know why that hit me so hard, but I was just like, wait, I'm going home with my genetically formed baby, but I'm not the mother on paper. Like, it just blew my mind. So we were going through this whole process. Meanwhile, they had put me on a medication for 2 months that was essentially supposed to put me into menopause and allow me to start over in terms of the transfer, so that we could kind of wipe all the hormones out and start fresh. And so once I finished that, then I started the prep for a transfer. We were still doing the medical evals and stuff with our surrogate at this point. And so then we started the transfer struggles, where my uterine lining would not thicken, they want it to be above 8 millimeters before they transfer. And I could not get mine above 5. And I was on, again, we were doing every drug. And you go through the entire, 2 week, basically there's 2 weeks of, like, stimulation, and then there's a trigger, and then a week later you would transfer. So this was like a 2 to 3 week process every single time, only for it to be canceled in the end. So, I went to monitoring visits. It was like checking your lining and just, like, praying that you get a few millimeters every time was just torture. And so we were like, at this point, we were grateful we had the surrogate, because we were like, well, this isn't looking good for me. And having 3 canceled transfers like this was just, it was the first time in the process where I was like, I'm done. Like, I don't know if I can do this anymore. Or at least I need a break. Like, emotionally.
Yeah.
It just, like, this was so much longer of a process. It was affecting me at work. I needed a break at the very least. But it's the first time that I said to my husband, I don't know what to do. And I feel I don't want to give up, but I need to stop for everybody, for everyone involved.
I'm running out of gas here.
Yep.
Yeah, and there's not a gas station in sight.
No. So, at this point, our surrogate, she had just had her medical evaluation, and turns out that she needed this vaccine in order to proceed, and it was a VZV vaccine, and so it was a shot, and then it was a booster a month later. So we were delayed 2 months with her. Okay. So, I
also,
guess
had she been a surrogate for another family before?
Yes, one other family. They only had one embryo, and it didn't work. She had her own child. So in order to be a surrogate, you basically have to have proved that you're capable of having children. And, that's kind of it. As far as there's a lot of things, but that's basically the gist of it.
So she had one successful biologic child, mm-hmm. and then she had one failed surrogacy with a different mm-hmm. family. Okay.
Yeah. Which, to us, the one failed transfer wasn't surprising. Again, by this point, I knew that it took up to 3 for 90-something% of people. So I wasn't, in my mind, I was okay with that. But it was a little bit riskier knowing that there was never a successful surrogacy before. So she ended up getting delayed 2 months. And I don't know why, I just decided, I said to my husband, let's just do one more Hail Mary transfer. It got delayed. Let's just do it. If it doesn't work, it doesn't work. And we got into this huge fight because he was like, what are you talking about? We just agreed to focus on the surrogate. Why are you kind of shifting the plan at this point? And I said, I don't know. Let's just do one more. Please just let me do one more. I need it to feel okay to move forward.
Women's intuition.
So for this one, the 2 things that I had done differently were that, I'd read papers where, and I talked to this, Colombian fertility doctor who basically required that all of her patients did hyperbaric oxygen therapy as part of their stimulation during prior to the transfer, or even prior to the egg retrievals. And there were some studies that suggested that it was helpful, but they were still, there was no protocols or anything. And then NAD injections were another thing that were used. So I did my first NAD injection where I thought I was going to die. I never had it before. I just the feeling you get after injecting the NAD was I thought I was going to die. I felt like I was having a heart attack and I was dizzy. I was like, oh my God, I don't know what I just did. Okay. But
where did you get this NAD substance?
It was actually, oh God, this sounds terrible. But it was at a med spa, but it was a med spa that they also did the hyperbarics at the time. I'd known them for a while. I did trust them. They had warned me that the dose, I guess it has to do with the infusion itself and the dose. I don't know. But I told them to do as much as they possibly could in any given sitting. So that was also my fault for not just trying to go balls to the wall basically with it.
Yeah. Hail Mary.
So I did
you said.
NAD injections, and then I did the hyperbarics during the first 2, using this protocol that I had read about. And then we went out to Colorado, and we went out to dinner the night before. I had red meat and 2 glasses of wine, and ended up doing the transfer the next day, and it worked. We found out 9 days later that it worked, and here we are. So we let our surrogate know. We released her, and then we just crossed our fingers and hoped that this would stick, and that the pregnancy would be full term, or we'd get a baby out of this, because even though the embryo stuck, now there was this whole new journey
challenge.
But we had just kind of, at that point, we were like, okay, I can get pregnant. So that's positive. And let's just run with this. So
talk us through the moment when you found out you were pregnant, whether it was through a blood draw or a urine dipstick.
So because I had had all these failed or aborted transfers before and stuff, I knew they give you an HCG shot. So the HCG that they test for is in your system. So I had already known about how long it stayed in my system after a transfer. So again, being the crazy type A person that I am, I had immediately started testing my urine 3 times a day with 3 different tests. I know it sounds crazy, but there's just so much variability. And by this point, again, you try to control anything you can.
Yeah.
So I had obviously gotten a positive test the next day, but it was it was because of the shot. And then
the injected HCG. Yeah.
Correct. And so then it turned negative and I was like, okay. And it was around day 4 after the transfer. So it was negative for a day and then it was negative again. And I was like, and again for like another, I think 2 days. And then it was on the 6th day or the 5th day. I can't remember now, at night. And I saw like this very faint line. Like you had to squint so hard.
You're like, am I seeing this? Is this my brain playing a trick on me? They call it
line eyes. Like people post on these Facebook groups that I'm in, like, is this positive or do I have line eyes? And you get this, basically this, yeah, there's something there. No, it's not. Sorry. So I had went to the kitchen to my husband and I showed it to him and he just looked at it and looked at me and was like, he's like, you should probably just wait for the doctor. And I was like, I know. He's like, I just don't want you to get your hopes up. I'm like, I know, but like, this is the first time we've seen this ever.
Yeah.
And my husband just got up and like gave me a hug and then like walked outside. I'm pretty sure he like went out to cry or something.
Aww.
And I cried. Like, I was just like, I don't know if this is real or not, but at least it's the first time I've ever seen this.
I would imagine there's been lots of tears over the last 3 years. And these were the first tears of like joy.
Yeah. Of hope, of joy, of something. Even though I knew in the back of my mind, don't do this to yourself, Melyssa. Like, I don't, like this could totally not work. So then I kept testing and the line got darker and it kept being positive like 3 times a day on all these tests. And I kept them all. Like I kept them all in a drawer until like I was like, I don't want to throw these out because I feel like that's like bad juju. And so then we had our blood test and I was like such an emotional wreck that whole day at work. And I couldn't really tell anybody except my office manager who knew. And then we got the call and I was at work and they like, ideally they wanted your like HCG level to be over 100. And they called and they said it was 115 and I just like lost it.
You're like, this girl's pregnant. This girl is pregnant.
I was like, oh my God. And I called my mom right away and my mom cried. I called my dad. Like everybody was crying, in my office and I had to like somehow go back to work and function, in like a happy way. But I did it. And then we had, another draw and it like advanced or doubled the way it was supposed to. And then it kept doubling. And then I ended up doing my own blood draw one more time and it was still going good. And then they bring you in at 5 weeks to check and make sure that you are, that there's something in the uterus. And they checked and they saw something, but it was like too early if there was a heartbeat or if it was like really the yolk sac or whatever it was. So I had to go back again, a week later for a heartbeat check. Cause I guess I think it was at 6 weeks or 7 weeks that you can actually start to hear a heartbeat, which is crazy to see that like you can actually hear a heartbeat at 6 weeks.
Yeah.
And I went back at 6 weeks and, we did the ultrasound and there was a heartbeat and it was just like there was at that point in my life, there was like not a better sound in the world. Mm-hmm. And we just couldn't believe it. We were still in disbelief, cautiously optimistic, but there it is. And we were like, there's a baby in there. And it was just incredible. So.
Any issues with your pregnancy or delivery thereafter?
No, it was actually, the pregnancy was so smooth. I was like so lucky in that respect. My pregnancy was great. Other than like the worst heartburn, I have a newfound sympathy for people with heartburn, but,
yeah.
And the fact that I only ate cereal for like the last 3 months because of the heartburn. I ended up delivering early. Well, I'll take a step back. We actually, because of the IVF and my age, we had to do some like extra testing along the way. Everything like the NIPT testing, you had to see a MFM doctor. There's an increased risk of congenital malformations in IVF babies. So I had to see a pediatric cardiologist for a fetal echo.
Oh, wow.
Which they found she actually has a aberrant right subclavian artery, which brought back ENT boards to me.
Yeah.
But
they
she's totally
diagnosed
fine.
that in utero?
Yeah, at 24 weeks, which is
Wow.
wild. And then I ended up having a little, it's like some high blood pressure and really low amniotic fluid around 36 weeks. So they ended up inducing me early because I stopped feeling like fetal movements. And the baby was okay, but they were like, you know, you've come this far. You know, we think it's, I mean, my fluid was like just at the cusp of actually, you know, inducing me. And I was like, you know, I'll do whatever you think you need to do. And so they induced me. I got my epidural. I passed out. My blood pressure tanked. I needed like epi and like whatever, but like, I don't know. I woke up from being out of it for like an hour, and I was in the hospital, and they wouldn't let me lay on my back because of the blood pressure. So I was on my side eating a popsicle, and all of a sudden I turned to my husband. And I was like, I think I'm going to shit the bed. And he goes, what?
Famous last words.
Yeah. I said, I think I'm about to shit the bed. I said, can you please get the nurse? And he's like, no, it's just the meds, Melyssa. You're fine. He's like, just eat your popsicle. I'm like, if you don't know, I was in the hospital that I take call, like I work at. I'm like, I'm not going to be a code brown in this hospital. Okay.
Also, every L&D nurse right now is like, nope. When you feel like you have to shit, that's a head coming out.
Yes, exactly. So the nurse comes in and she checks and she's like, nope, you are having your baby. Oh. And instinctively I cried for help. I don't know why. I just screamed for help. And she looked at me and she goes, Melyssa,
we're here.
I am the help.
Yeah.
And I was like, oh my God. And then she came out in 4 pushes and she was great and everything was good.
Oh my gosh. Okay. And now she's 6 or 7 months old now?
Almost 7 months.
Okay. Tell us about your daughter.
Her name's Olivia. She is the happiest little baby on the planet. She's the best. And we just took her to France for her first vacation because my husband was over there for work, and she's crawling and pulling herself up on things and just making lots of noise. And she's just amazing. She's the best. She loves the water. She loves the boat. She's definitely like my husband's mini me. She's definitely a very chill but determined little baby, and she's perfect. So and she's healthy, and that's all we could ask for. So
everything was worth it.
Everything was worth it.
In the end. Yeah.
In the end. And, you know, we're lucky that we got our happy ending, I guess. You know, there's a lot of people out there that don't. And, you know, throughout this process, that's one of the things that I learned is that there's so many of us, especially in medicine. I mean, there's a Facebook group with just like 4,000 doctors, female doctors who are struggling with infertility. And there's probably more. There's probably so many more. But this is just one little Facebook group. And I realize that we don't talk about this enough. And there's not a great community especially for female physicians. And they don't teach you this stuff in residency. And nobody is there, you know, supporting you or giving you options or even, you know, telling you that there are options, you know, and then there's the whole financial and insurance part of it. So as a resident, there's no way I could have done this. But that's what really, you know, encouraged me to just be open about this, because it's out there and there's so many people that struggle with this.
And I feel like it's like a little bit of like whispering or kind of these like rumors that healthcare providers, specifically female physicians, have lower fertility rates. Is that something that you ever had in your mind, like as a med student or a resident at all?
No, I mean, I had heard that, but not as a med student. It was more like once I got out of fellowship or when I was in fellowship, because I was like, all right, well, I'm moving again. Like, I'm still not married. Probably going to freeze my eggs. So I kind of started just looking at things. And there was a paper at some point that had come out about female physicians and surgeons in general having lower fertility rates and having a higher rate of miscarriage. And so that's, again, one of the things that prompted me to say, freeze my eggs, or freeze embryos, or at least go down that pathway of fertility preservation.
Mm-hmm.
And I think it's a double-edged sword because, yeah, the higher stress doesn't help. But for me, I also needed to work because I needed the money to pay for these very expensive fertility treatments. And some insurances will actually cover it, but there's a lot of stipulations on what they cover too. So, for example, a lot of them don't allow embryo banking, meaning once you do an egg retrieval and you get an embryo, you have to transfer one of those embryos before you could do another egg retrieval.
So you mentioned like this would be fiscally impossible as a resident. Talk about, and I'm sure every clinic is different, the travel costs. I mean, do you have any idea how much as a couple you spent like in total with everything that you've been through?
Yeah, it's not a cheap endeavor. My husband and I spent well over $250,000. Between the cost of the procedures, the medications, which insurance, I blew through my maximal life amount of pharmacy or drug costs within the first 2 rounds. And then, of course, we had the surrogacy. So there were legal fees. We paid for her legal fees. Everything is out of pocket with that. The travel and the accommodations in Colorado, all the lab work, and just, yeah, it was one of those things where you can't really put a price on having a baby, but it's not cheap at all. It's not cheap. And there are options out there, and insurance does cover it to some degree, but for us, it didn't. And it was just something that, unfortunately, we had to pay out of pocket for.
Wow, I had no idea. Oh, so then that leads me to the question of like, Olivia's 6.5 months old. Have you guys even talked about the future? I mean, you mentioned earlier that you initially wanted 2 children.
And we have, and one of the things that people had said to me is, oh, well, you'll probably just get pregnant naturally. And of course, like, you hope that happens. You hear all these stories of these people who, they stop thinking or caring about having a kid. They decide they're not going to, or they weren't, surprise babies. So there's still a small part of me that like hopes that it would happen naturally. But at the same time, like, part of the reason that I was having trouble, was because I have totally irregular cycles. My cycles are like 40 something days long, and I don't always ovulate. So, it's harder to get pregnant when you don't have as many chances in the first place. But we are comfortable that if we needed to move forward with IVF again, that we would. And that's why we have, 4 more frozen embryos. And, we hope, I would do the exact same thing. I would do the hyperbarics. I would do the NAD, just do all of the things. Whether that was the reason or not, we don't know. But it also is a different perspective when you have a baby, when you have the child, that pressure is sort of off. We've said that if we only have one, we're okay. Like, we will be very happy and grateful for our, one beautiful, healthy daughter. And that pressure of that lack of pressure is so huge mentally for me. It just, if it happens, it happens. We would love to have another kid, and however it happens, we'll do it. So,
oh, sweet Olivia.
Sweet Olivia.
Oh, well, okay. And then Dr. Melyssa Hancock, tell us a little bit about your practice as well.
Sure. So I'm a facial plastic surgeon in Boca Raton, Florida. I really love rhinoplasty and revision rhinoplasty. Still do some aging face stuff and getting back more into that, but rhinoplasty is really what I love. And we do a lot of functional sinus and nose stuff as well here. So we really are the one-stop shop for anything functional and cosmetic of your nose and sinuses. So
for anyone out there who's wanting to learn more about your journey, can you tell us what platforms you're on?
Sure. I am on the World Wide Web, Instagram and TikTok. I know nothing. You're definitely way more better at social media than I am, but I'm on Instagram at Dr. Melyssa Hancock and Dr. Melyssa Hancock on TikTok.
I want to thank you for just being so like raw and real and vulnerable, because I think talking about it is so helpful for those who are going through it. So thank you again for sharing today.
Well, thank you for having me. And I really appreciate your questions. I thought they were really thoughtful. So thank you.
Today's episode is brought to you by the Hippocratic Collective. Check out our shows and content at hippocratic-collective.com.